So thank you all for joining us. We're really excited to get to share a little bit about our program here at the Division of Environmental Health Sciences, and particularly about our MPH program. Our mission is to train students in the skills necessary to learn how human populations, especially the most vulnerable members of our society, such as young children, pregnant people, workers, and those lacking resources and power, are affected by environmental exposures, ranging from microbial and chemical contamination of water, air, and other media, to climate change, industrialization, and unplanned urbanization. And we do that by building up the tool set and skills of an environmental health scientist in our MPH students. So this is a list of kind of all the different potential topics that you would learn. And so we have exposure science, which is like kind of the bread and butter of environmental health science, toxicology, epi and biostats, health risk assessment, and there's a lot of different types of focuses within environmental health science, and you can really kind of pick and choose and like build up your skills in these different areas. Here is some of our faculty and staff. And what I want to highlight is that, and I'll show you on the next page, is we have a compendium of EHS expertise. And so these are all the different areas in which our faculty work. And so we have air pollution, global climate change, environment, infectious diseases, the list goes on. And many of our faculty work on kind of intersections of these different topics as well. And so we have a link here, which will be shared with you all. There's a compendium that we have that lists the faculty members within each topic, as well as like associated faculty and researchers. And this is a way that you can get to better know the faculty and the type of research that's happening here within our department.
So this is an MPH presentation, but we did want to give you just an overview of what programs we offer within the Environmental Health Sciences Division. So for MPH programs, we have the Environmental Health Sciences, which we call EHS, MPH, and then we have the Global Health Environment, which we call GHE, MPH. And we have concurrent degrees. So we do have the option of getting an MPH and a master's in city planning. And we also have the option of getting an MPH and master's in journalism. So as Lori had mentioned earlier, these are ones that you would typically apply to at the same time when you're submitting your application for the MPH. We do have two MS programs, an EHS MS and a GHE MS. And we also have one PhD program, which is our Environmental Health Sciences PhD. For students that are interested in industrial hygiene, we do have a concentration in industrial hygiene, and we also have a certificated program for students that are interested in ergonomics. And so we get a lot of questions regarding what's the difference between our EHS and GHE MPH programs. So some of the differences are that EHS is more focused on physical, chemical, and biological agents found domestically and globally. GHE is more focused on environmental issues impacting low and middle income countries, as well as global issues such as climate change, sustainable development, or planetary health. EHS curriculum is also more prescribed, while GHE is more open to allow for transdisciplinary coursework. Also, EHE tends to be more quantitatively oriented compared to the GHE. In terms of similarities, both of these are in the same division. So everything is housed in the Environmental Health Sciences Division. So there's the same pool of faculty for the faculty advisors. You will have the same breadth requirements for the MPH programs. There is also the same rigorous background in environmental health and exposure assessment. You will also have the same capstone, same internship and career preparation and resources and requirements. You can go to the next slide. And so we wanted to just give you a brief glimpse of the curriculum for these two programs. All of our, it says BPH, MPH. BPH stands for Berkeley Public Health. So our BPH and MPH students all have to take these breath courses. So that's expected of everybody in the MPH programs. For our EHS MPH requirements, you can see the list there in the middle column, and then you can see the required courses for the GHE. And you'll notice again that the GHE requirements are shorter, but it's really, again, so that these students can tailor their specific interests and be able to take classes across the divisions, but also across campus. Okay, let me switch to the next screen. Okay, and then we have, as I mentioned earlier, we do have a concentration in industrial hygiene. So industrial hygiene students would take what the EHS MPH students are taking, as well as a series of other courses. And it does make it so that you do have less options in terms of taking other electives. But to be honest with you, many of our industrial hygiene students would probably take a lot of these classes anyways, because that's their field of interest. But, you know, and we do have many students who, in the spaces that they do have, do take some of the additional optional elections as well. In terms of our admissions data, this past year for our EHS MPH, we did have 50 applicants and 37 of those students were admitted. For our GHE MPH, we had 38 applicants and 32 of those students were admitted. And we had one EHS MPH MCP applicant, and that student was admitted. In our cohort, so these are our students that are coming in and also our students that are continuing. For our EHS MPH, we have 31 students. For our GHE MPH, we have 16 students. And for our MPH MCP, we have 3 students. So it's about 50 students. And this is typically what it looks like. It can look a little larger, but typically I would say that EHS MPH group tends to be bigger, almost double the size. There are a few occasions where we might have the same amount of GHE MPH and EHS MPH, but typically the EHS MPH group program tends to be larger.
And I'm going to share a little bit about the practicum, which I think might have been touched on already by earlier, but I will be the practicum field consultant for the environmental health science, so both EHS and GHE students. And so for your 10-week field placement, I'll be helping with supporting the kind of seeking out practicum, the process of confirming your practicum and going through the process of it over the summer. And so, yeah, I would be here as a resource for all things practicum. And then we just wanted to share a little bit about where EHS and GHE alumni have been. I know Lori should shared kind of where all School of Public Health students have gone. And so here are some of the places that our division students have gone. And so it really, as I think is true for the School of Public Health, it really spans across the different areas. So we have students going into the private sector, working for consulting companies or startups and stuff in the area, working as environmental health scientists or industrial hygienists. We have students going as researchers, program managers at local health organizations like the California Department of Public Health or the Office of Environmental Health Hazard and Assessment. Also, I forgot to mention that these are also places where students will do their practicum as well. And so this is also an example of some of the places where students can do their practicum. And sometimes that leads to jobs. If anything, it leads to really great networking opportunities. And then there are also students that will work at universities and academia or continue on to a PhD program. And then there are also folks that have gone to work at Silent Spring Institute, various nonprofits and NGOs. And so, yeah, there's a lot of different opportunities for students across the spectrum. And then we just wanted to share that as being part of VHS, there is like a whole community of support. And so each student is assigned a faculty advisor, although you're always welcome to reach out to other faculty members as well for support within the division and even outside of it. We also have a student buddies program to pair first-year students with second-year students to help with kind of acclimating into and adjusting to university life and the program. And then as you have seen, like you have both Gladys and I as your program manager, and then I as your MPH coordinator and practicum field consultant. And then the School of Public Health too is like a great community, and we have other offices like the Dream office, the Rise office, and then our librarian, as well as all our staff that are all very willing and wanting to support you all.